Hello everyone, my name is Marissa Staten with RevitalyzeMD. I'm a medical esthetician and laser technician, and today we're going to talk about the triple glow treatment that we offer. There's also going to be a live video, and I'm going to kind of talk along with it and kind of tell you the details of what we're doing. But before we get started, let's go ahead and have you like, subscribe, and follow us, and let's get started. Okay, so this is step one. This is dermaplaning. Dermaplaning is physical exfoliation and basically defuzzing. So we're getting any peach fuzz or hairs that's on the skin, but it's also called epidermal leveling. So that's literally what we're doing. We're leveling the epidermis that preps the skin for the next step. The next step could be, because this is going to complement other treatments or your home regimen. So we're getting the dead skin off, prepping you for the Hydrafacial step 1 and step 3. And I'll get into those steps once we get there. But right now, as you can see, I am going all over the face. I like to start low around the jowls and the cheeks because it's a larger area and it's smooth, and I like to make sure I get right under the ear really well, and right there at as we call the sideburn area, because a lot of us get a lot of extra peach fuzz in that area, a lot of hair. So I want to make sure we get that. And this treatment also alone is going to help your makeup, for instance, wear smoother, but again, it's going to help anything that you do after this work better, penetrate deeper, and more evenly. But you can see I get really high up on the orbital bone, right under the eye. This makes such a difference. So I get on the submental area, right there under the jowls, because obviously a lot of women get extra hair right there on the chin in this little area. So this will get rid of that, but you can see how much dead skin we're getting off. That's amazing. That's dead skin and hair. We're getting rid of it. We also tend to get a lot of hair on the corners of our upper lip. So here in a moment, you'll see when I go over that area that I really make sure I get that area really, really well. But I get up to the lip line. I take my time with it too. This feels really, really good. I have a lot of patients that actually go to sleep during this treatment. You can see I'm getting the outer corners of the lip really, really well there. But it's very, very comfortable treatment. Very relaxing. I get up to the brow really well. It makes your brows look more prominent. And I get up right up to the hairline and in between the brows as well. Don't do the nose. Most people don't need that, but it is a blade, so we practice safety first. All right. We have completed dermaplaning. Now we're moving on to the step 1 of the Hydrafacial. This is the exfoliation. It is with lactic acid, and I'm just evenly distributing the product, or the lactic acid evenly all over the face. The product's actually going to do the job, so I want to make sure I have it evenly and it's not running anywhere. And then we'll go to step 3 of the Hydrafacial for deep cleansing and extractions. So basically, when you do the dermaplaning first and then you do the exfoliation on top of that, you're getting a more even exfoliation. So like I said before, the dermaplaning is going to make everything more even. So this is the extractions. So I'm deep cleansing the pores before we go to the LaseMD, laser resurfacing treatment. And if we do this step first before we actually do the resurfacing, we're cleaning out the pores. And when you clean out the pores, get the debris that's ready to come out, you're going to get a better shrinkage of the pores with the next step. I get the nose really, really well. Everyone has a little bit more congestion in this area. So we want to focus here for sure. And of course, as you saw on the chin, we did that as well. And then as soon as we get done with this, we are going to rinse the product off very, very well. And the skin is prepped and ready for an even laser resurfacing with the LaseMD. So I'm always checking with the patient, make sure they're doing okay. All right, so this is the LaseMD laser resurfacing. I like to start on the cheeks. Just basically our skin on our cheeks is meant to be a little loose for movement. So I feel like if I can start with the cheeks on a higher setting, of course, with patient comfort, I feel like they get a better treatment. So I start here and then lower it for mid-face if the patient needs me to. We don't have any numbing cream on, so they are going to feel this a little bit. It's just a warm, hot, prickly feeling, but it is very tolerable. And if not, I'm going to ask the patient anyway, and they're going to let me know. But what this treatment is going to do is obviously resurfacing. It's going to help shrink pores. It's going to brighten the skin. It helps with texture, static lines, obviously fine lines and wrinkles, and it makes such a difference. Some people get a tightening effect, but that's usually on a higher setting. But the fact that it shrinks the pores and helps with the static lines, the orange peel skin on the chin, really focusing on the nose when we get there, but it's amazing treatment. And there's minimum downtime. Downtime is just so you're gonna be a little red afterwards. A little red, and your skin will feel a little rough like sandpaper for a few days following, but that is it. And most people don't notice that. If they're looking at you, you will feel it. But every time you wash your face, there'll be less and less of that roughness. And that's basically, instead of peeling like most laser resurfacing treatments, this one just makes your skin feel a little rough for a few days. And actually that's really nice because a lot of people don't like to flake for 5 or 6 days. So that is a plus. So you have another option. So after we've leveled the epidermis with dermaplaning and done that physical exfoliation, got the peach fuzz off the skin, and then did step 1 for the Hydrafacial, which is more even exfoliation. Did a deep cleansing with extractions for the step 3 of the Hydrafacial, and now we are resurfacing. So that's how well this works hand in hand. And you can see the patient has no numbing cream on, so she is tolerating this very, very well. I'm doing the forehead now. And I'd like to go into the brows if the patient allows me to. This laser is not going to have any impact on hair loss, so it is perfectly safe to go into the brows. It's not the laser wavelength that gets rid of hair, so there's no concern there. But I feel like when you are able, if the patient allows you to go into the brows like you see me doing right now, I feel like they get a little bit of a brow lift. That's just bonus. But I love doing that. You see, again, the patient is tolerating this very, very well. So that just goes to show that you can do this without numbing cream and it be very tolerable. Well, that is it. Thank you for watching. That concludes our Triple Glow treatment. Please like, subscribe, and follow. Let us know if there is other treatments you would like to see that we haven't already done, or maybe you have some questions about what we have done. But anyway, again, I'm Marissa Staten with RevitalyzeMD. I'm a laser technician and medical esthetician, and I would love to hear more from you. Thanks so much.